And our last presentation before the morning break is by Doris, Leung, and Kelsi, Jessamine, and they're with the Community Veterinary Outreach Program, and I think going to be talking about companion animals and street-affected people. Ladies.
Hello, can you hear me? Okay. Hi. Oh, okay. Can I move this up a bit higher? Or? Okay. Hi, my name is Doris, and this is Kelsi. I just wanted to thank BCCDC for inviting us to talk about our work with community veterinary outreach and our the results of our One Health clinic in Vancouver in the past year. Okay, so before I begin my presentation, I wanted to acknowledge the land in which we gather the unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Secondly, I wanted to acknowledge our local and regional partners, which includes Directions Youth Center and Evelyn Seller Center, where we're hosting our One Health clinics, Pause for Hope Animal Foundation, where we're providing veterinary health care, University of British Columbia, as well as Vancouver Coastal Health for providing our human health services, Royal Canin for donating pet food, PetSmart Charities, Yaletown Pet Hospital, South Burnaby Vet Hospital, Whole Foods, Noah's Pet Ark, and lastly, Community Veterinary Outreach is solely voluntary basis, solely a voluntary run program. So really we do acknowledge the full dedication of our volunteers, and we really can't do the work we do without them.
Okay, so homelessness in Vancouver over the last decade. Homelessness has continued to rise. Some of the social determinants of health that contribute to factors for individuals living on the street include abuse, poverty, mental illness, and trauma. So as we know, pet ownership amongst the homeless community remains significant in British Columbia. According to the Homeless and Street Involved Youth Survey that was done in 2014, 44% of youth in Vancouver had a pet. While this is significant, this is actually smaller than some of the other more rural communities in BC.
So in terms of the animal health of street animals, of animals that are owned by homeless and marginalized pet owners, a recurring theme in our outreach clinics from Ontario showed us that a lot of these pet owners are placing their pet health over themselves. So they're prioritizing the health and needs of their pets over their own health and needs. And in terms of like putting it in a very siloed veterinary approach, I mean that's not really much of a concern for us. These owners are very cognizant of their animal, and they're very attentive to the behaviors or any changes in their animals. In terms of a more holistic health approach, it is concerning. Being homeless and having a pet could indicate barriers to access in healthcare, barriers and access to shelter services in Vancouver. We do find that street pets, especially street dogs, tend to have improved body condition scores because they tend to have more exercise than our sedentary condo dwelling dogs and cats in Vancouver. They're often more socialized as pets as well, especially street dogs, because they're in close interaction with a lot of different animals and a lot of different people. There's no significant findings in disease prevalence, and so with a lot of our outreach clinics, really the pets that come in, they look just like the pets that I see in private practice. So they still suffer from the same chronic conditions, so a lot of chronic renal disease, diabetes, arthritic conditions with our geriatric patients, so no real significant difference in disease conditions. We do find that these pets tend to have more, maybe probably grooming issues because pet owners are not able to readily access grooming services. And obviously, lastly, there are financial limitations for pet owners for tertiary care of their animals.
So in terms of the human health, we've learned that actually the animal has very positive effects on the health of the marginalized pet owner. The pet acts as a catalyst for positive change by providing a sense of responsibility and purpose. The pet will offer unconditional love without judgment. And also the research has shown that the pet, individuals living on the street who have pets have a decrease in risky behaviors such as drug use. And the pet can act as a protective factor in mental illness, resulting in a decrease in anxiety and depression.
So Dr. Fraser mentioned earlier about the One Health concept, and the One Health model is gaining a lot more traction in the public health and veterinary arena and solving a lot of health-related questions. And so the One Health model really is basically explaining that animal health and human health as well as environmental health are all interconnected. It does require a collaboration from multiple disciplines, and really by improving animal health we can also improve human health as well. And so how does this apply to Vancouver? How does this One Health model apply to Vancouver? Here we have companion animals owned by homeless and marginalized youth pet owners. These youth pet owners tend to reside in Vancouver's downtown east side, as well as Commercial Drive and Granville Street. And how do we incorporate services to improve the health of both animals and humans? We do require collaboration with local partners that we've listed earlier.
So CVO began in 2003 in Ottawa as the Mission Veterinary Care Program. So CVO's mandate is to provide preventive veterinary care to the companion animals of those in need, and thereby not only improving the health of the animal, but improving the physical and emotional well-being of the owner, and overall contributing to the public health of communities. So currently we have clinics in Ottawa, Hamilton, Toronto, North York region, which is just outside Toronto, Kitchener-Waterloo, and Guelph, which are both in southern Ontario, Winnipeg, Halifax, and now in Vancouver. So Vancouver was actually the first One Health clinic. So we collaborated with Pause for Hope, as Dor mentioned, who provided the animal care services, and UBC School of Pharmacy and Nursing, who provided the human health services.
So with our One Health pilot project at Direction Center that Kelsi will be chatting about shortly, our objectives were to collaborate with local partners and health agencies in Vancouver to deliver free veterinary and human health care services. We leveraged the human-animal bond to allow for health promotion amongst at-risk, street-involved, and homeless pet owners in Vancouver. We also collected and analyzed data to better learn about the population that we're serving. We built on the health benefits and protective factors that are associated with pet ownership and within marginalized populations. And we also connected owners to care whenever indicated in a stigma-free and judgment-free zone.
So what does the methodology look like? So we have organized clinics at various health centers and community centers in Vancouver. Clients are referred to the clinics through our community partners or by walk-in basis. Veterinary care is then provided by Pause for Hope, where messages of human health are echoed through the veterinary appointment. Parallel human health services are then offered following the appointment. So this could look as the veterinarian talking about respiratory conditions related to secondhand smoke in their pet, and then offering the client smoking cessation programs or information following the appointment. We then measure rates of uptake in the human health care services, and we have found that the engagement level is much higher than anything you'll find in the literature without the veterinary appointment. So services we have offered on the human health side have involved naloxone kit training and distribution, which has been very profound with the fentanyl crisis existing in British Columbia. Flu vaccines, sexual health education, wound care, and connections to community partners and services. So One Health in Action. So our first clinic, as Dor mentioned, was at Direction Youth Services and was held on December 4th last year. We worked closely with the managers who are depicted in the upper right-hand corner, Matt and Nikki. We chose this location because they have such a great connection with the downtown population of street-involved youth, and allowed us to reach our target population.
So from the veterinary side, we had volunteers that were veterinarians, veterinary technicians, and assistants, and we were able to provide general physical exams, core vaccinations such as DP, rabies, FERCP. We provided diagnostic tests whenever indicated, such as urine tests and blood work. We provided parasite prevention, as well as pet toys and supplies and pet food donated from Royal Canin. And so, overall, the results of the One Health Clinic with, on the veterinary side, we provided services to 25 animals, which included 12 dogs, 9 cats, and 4 rats.
And on the human health side, prior to the clinic, we had met with Directions, the managers there, and the nurse practitioner at Three Bridges Clinic, which serves the downtown community of street-involved youth. And they said we'd be lucky to have about 10 to 15 clients turn up. Well, at our pilot project, we had 40 who we directly connected to care. So we provided 33 naloxone kits with the associated training, 11 flu vaccines. Other health services that we provided included mental health support, health promotion, harm reduction, any kind of community care referrals where the client needed additional treatment. Yeah, so it was a much greater success than we could have anticipated. So the One Health pilot project here in Vancouver ended up receiving national recognition. The outcomes. So since the pilot, we've had 3 additional events in Vancouver and have reached over 150 marginalized clients in the Vancouver area. We presented at the Community Health Engagement Healthcare Improvements Conference in Texas, where our model was very well received by a rather conservative state. We have our upcoming clinic on November 26th at Direction Youth Services. Yeah.
So some future projects for community veterinary outreach in Vancouver. We would like to have more scheduled One Health clinics. Right now we have 2 One Health clinics and 2 pet fairs in a year, but eventually if we could schedule a few more on a regular basis, that would be awesome. We would like to increase collaboration with local partners. Right now, as Kelsi had mentioned, we have partnership with Pause for Hope, University of British Columbia School of Nursing and Pharmacy, but maybe eventually if we could provide any dental hygiene services, that would also be very helpful to this population. Thirdly, we want to engage these marginalized pet owners. We find that youth tend to be very difficult to engage, so how do we engage them in maybe a more creative process? Maybe even involving them in creating our posters, or maybe involving them in how we plan our clinics, and maybe even providing more customized of an approach in knowledge dissemination wouldn't be a bad idea. We would like to qualify uptake of our health services following referrals. We would like to also expand to new communities in BC. Kelsi had pointed out in our 3rd slide that we have 44% of pet owners homeless pet owners in Vancouver, but we actually have 72% of homeless pet owners in Kelowna. So that's perhaps a community that we could hopefully expand our services to. Lastly, we want to continue to support student learning and continuing education. We want to continue presenting at conferences like these ones, as well as community conferences. So I wanted to end our presentation with a quote from our founder, Dr. Michelle Leung. She says, "We realize that the potential of veterinarians of veterinary care to influence the health and welfare of marginalized people who are pet owners. The opening is the animal."
All right. Questions, Nancy?
Hi, my name is Nancy DeWitt. I'm a veterinary epidemiologist with the BC Ministry of Agriculture. Just had a question about the pet rats that were brought into the clinic. Were these by any chance wild rats that had been tamed?
We had, so with this One Health clinic, we had 4 rats, but in our subsequent clinics, we've had a few more. maybe, but they were actually quite domesticated. They were very well socialized, and we really didn't have an issue with handling them during our clinics.
Hi, I'm Michelle. I'm a PhD student. I'm a veterinarian and a PhD student in epidemiology right now. So thank you very much for your presentation. It sounds like an amazing project. My question was, when you put up your title slide, you said it was a One Health clinic, and you mentioned that there's health for animals, for people, and then also for the planet. So I was wondering if you could comment on was that something that was incorporated into your appointments in terms of like, for instance, discussing like more severe weather events and how humans and their animals are affected or could be protected against events like that? Or was there a specific component of the planetary health that is incorporated into the clinics, or is that for the future?
I think in terms of the environment aspect of the One Health model, I think with this pilot project in Vancouver, it's more of really the community with which we're conducting our One Health clinic. So Vancouver's downtown east side, and really I think with this One Health model, if we can improve both the welfare and well-being of animals and humans, we can thereby maybe create a healthier community within the downtown east side and also within our community as well. I don't know if that answers your question. Okay.
Very much. That's just absolutely wonderful work. Have you tried to connect with the St. Paul's urban health folk who have ongoing, sort of continuous programs in that, with these same folk who are probably have similar goals, although it's not One Health?
Yes, absolutely. So I'm actually a nurse by training, and a few of our volunteers who come to the clinic have actually worked on the urban health unit at St. Paul's. So we then will follow up with them when they're in the community, when they've recovered from hospital. Thank you.
Hi, I'm Jane Pritchard. I'm the Chief Veterinary Officer for the province of British Columbia. Thank you very much for your presentation. I really appreciated hearing about it and learning that this is growing in Vancouver. Had actually heard the first presentation of the work that was done in Toronto and Ottawa, I think it was. I just wanted to comment on the One Health aspect of this. It started as a One Health focus, but it's really grown into the One Welfare movement now internationally. Because the One Health environment, human animal, didn't fit. So the One Welfare part is something that's actually been replicated outside of the homeless with their animals. It's actually a growing area where health and veterinary medicine is working together to make sure that both sides are represented. It's certainly something that's become very needed in the area of animal welfare and human welfare, as well as animal health and human health. But I think this falls under the One Welfare banner very, very well. But thank you.
Marshit?
Thank you. It's very nice presentation, and I'm also happy to see that at least something started with One Health concept. So I was wondering that you get mostly the animal from the homeless people. So do you have any data to share with us that what kind of parasitic load on their dogs and cats compared to the dogs and cats living in apartment or houses?
That's a really good question, thank you. So right now, as mentioned, this is a pilot project in Vancouver, and so the data that we've collected, and most of our diagnostic tests have been mostly blood work and urine tests related to chronic conditions. I think that would be a good next step in figuring out, like maybe doing more fecal tests just to see whether there are parasites. There actually has been a study done recently in Oregon with Portland State University and the Oregon Health Authority, and they were looking at, it was quite a large sampling of fecal testing in street-owned pets, and the prevalence of parasitism was double that of the baseline within the country. And so there is definitely a zoonotic concern, especially because these animals are testing positive for Toxocara and Cyclostoma giardia, as well as Cryptosporidium. So that would be, I think that would be really interesting to see, like if we can actually have these One Health clinics and have more like routine fecal testing, then it would be really interesting data to collect. Thank you.
Good. Well, thank you to Doris and Kelsi and all of our other presenters this morning. So please join me again in thanking them all. All right, so that concludes the morning. I think we're off to an excellent start, and we're going to have a break now and reconvene at 20 to 11.